Hello, I'm Bob Challoner. I'm the President and CEO of Southampton Hospital, and I'd like to welcome you to another edition of Focus on Southampton Hospital, your monthly program about the events, people, and programs at Southampton, your community hospital. Today we have a very special member of our medical staff that's joined us, Dr. Elaine Karis, who is a rheumatologist, a specialist. Every once in a while I hear somebody say, what is a rheumatologist? And we'll answer that question. But we've also asked Dr. Karis to join us today and talk about something which many of us have heard the term, and I know myself included, are not really aware of what it is and what it involves, and that's gout. And gout, I've learned, is a form of arthritis, and we'll be talking about that with Dr. Karis. So Dr. Karis, thank you very much for joining us today. And as I always like to start, tell us a little bit about yourself, your background and training. I'm always so impressed with the background that so many of our doctors have, and I know you have a very, very long education that's brought you here. So let's talk about that for a little bit first.
Okay, Bob. Well, I went to medical school at the State University of New York at Buffalo, followed by an internship and residency at Beth Israel Medical Center in Manhattan.
Great. And
then I did my fellowship at the Hospital for Joint Diseases at NYU in New York City.
And your residency, I know, was internal medicine, and your fellowship was rheumatology. So tell me, how many years is that altogether?
Altogether, it's 5 years. It's 3 years of internal medicine residency and 2 years of rheumatology fellowship.
2 years of rheumatology. Wow, yes. That's very, very impressive, and we'll learn a little bit more. Tell me, how'd you end up out here in Southampton? At Southampton, I guess one of the obvious answers is you're up in Buffalo. You want to get away from the snow. Our winters are a little milder. That's a good reason. But you've been now at Southampton for 3 years.
A little bit over 3 years.
Okay.
I'm a New York City native. I grew up in Bay Ridge, Brooklyn.
Wow.
And the East End is, not too far from home.
Right.
And there was a need out here for rheumatology.
Right.
And it's a very nice place to live and raise my daughter.
Well, we're so thrilled to have you here, and I know you're the only board-certified rheumatologist out here. Well, no, I think we've just added another one, right? Recently, that's right. So but you are our pioneer in the field. Let's talk a little bit about rheumatology, just very briefly for people. Everybody always hears the names of these specialties, and many of us lay folk just don't really understand what they are. So just talk a little bit. What does a rheumatologist do?
So many people actually don't know what a rheumatologist does, but a rheumatologist is a doctor who specializes in musculoskeletal diseases. So diseases that affect the joints, the muscles, and the bones.
Okay, and I know the topic that we're going to talk today affects certainly the joints, and that's gout. I've heard of gout. You always hear about some member of the British royalty or someone else having gout at some point in history. And preparing for today, I learned it's a form of arthritis. I never knew that. And can you just give us a little bit of history on that?
Sure. Gout is the most inflammatory form of arthritis.
Okay.
It's been around since ancient times. It's been around, first described by the Egyptians in 2600 BC. It was also described by Hippocrates during ancient Greece, and until this day is present and is a very common form of arthritis.
It is. And arthritis is a term that's used to describe inflammation of the joints, basically, or?
That's correct.
Okay.
It's pain, swelling,
okay,
heat, and in general inflammation of a joint. Yeah.
Okay. So the term gout, where does that come from?
So gout comes from gouty, which is drop, and
drop. You said drop.
To drop.
Oh, okay.
And they used it to describe the dropping of a substance, which at the time they didn't know what that substance was, into tissue or joints, causing a very inflammatory reaction.
Okay.
So.
And I guess the sense was because the joint was inflamed, it looked like something had dropped in there or something. It was no one's too sure about
Perhaps.
that.
I think it was connected more to the idea that gout was a disease of excess.
Okay.
So excess alcohol, disease of kings, excess, meat, excess foods. So it was thought to be some kind of poison in the blood that was due to excess that then dropped into the joints or tissue, causing an arthritis.
Okay. What exactly is it? What is gout?
So gout is an arthritis which is caused by a particular molecule known as uric acid. And uric acid is naturally produced by the body, but in excess can cause several problems, but most notably gout, which is an arthritis that can occur typically can occur in any joint in the body, but it most commonly occurs in the large toe or in the knee.
Right.
But it can occur in the
Any
wrist,
reason
the
for that?
hands.
Why the large toe? Is that a...
So there are some thoughts. One thought is so this molecule uric acid precipitates out of the blood into the joints or the tissue, and this can occur because of changes in pH, changes in concentration, but also in temperature.
Okay.
So because the toe is further away from the heart, it's cooler.
Okay.
So that's one of the reasons it can precipitate there. It also precipitates, and gout occurs in joints that have been damaged.
Okay.
So you can imagine stubbing your toe, or your toe takes a lot of impact every
Right.
single day.
Right. Our feet really do get beaten up with
They
age,
do.
particularly, right? And you've used that term, and I've heard that as well, the disease of kings. And Henry VIII was the king that we often hear about as attacks of gout. Did he actually have it, and why disease of kings?
Yes, he did, and there are many depictions actually of kings and wealthy men with gout attacks, and you see them with their big toe, and they have these demons over them. And the reason for that is, as we said earlier, because gout is frequently associated and caused by foods that we associate with wealth, especially in the olden days, in ancient times or in the times of King Henry. Things like red meat, pork, shellfish, alcohol, specifically dark beer, port wine.
Okay. Things that the wealthier people would have had, not the common people.
That's
so,
right.
All right. And is it actually caused by those things, or is it an autoimmune disease, which I know a lot of arthritic diseases are? Is it actually that cause, or is there some underlying, like some people can eat all the red meat they want, never seem to get it. Other people are struggling with gout.
It's true. It is not an autoimmune disease. There are some predisposing factors. It can be genetic. So
Okay.
people who have gout in their family are higher risk of getting gout.
Okay.
And you're right that there are some people who get away with eating, things that are very high in purines, which are the source of uric acid, or one of the sources of uric acid, and still don't get gout.
So one of the terms you refer to, or I've heard people refer to, is gouty arthritis and gout. Is that the same thing? What is gouty arthritis?
So gouty arthritis is the actual arthritis that is caused by gout. Gout can come in more than one form, but usually will come in the form of arthritis. There are other people who get collections of uric acid in their tissues, and sometimes do not have the presence of arthritis, but actually have these nodules or tumor-like growths that are actually collections of uric acid.
Oh, okay. Well, that's the thing you've referred to a couple of things there: uric acids and purines. What exactly are uric acids, and why are they? Where are they coming from in our body?
So uric acid is naturally produced by the turnover cells in our body.
Okay.
It is also a byproduct of purines in our foods. So it's a breakdown product.
Okay. And what's a purine? That's just...
A purine is an amino acid.
Oh, all right. So it's as the body is, I guess, metabolizing these things, it's forming uric acids then. And it's the uric acid itself, or they talk about crystals sometimes. Is that actually a crystal that's actually forming inside the joint?
Under certain conditions, uric acid will precipitate out of solution or out of blood into tissue and joints as a crystal, and that crystal will come in contact with the immune system.
Okay.
And that contact of the crystal with the immune system is what starts the inflammatory process.
Okay. So the inflammation, I've heard this the inflammation is really the body working against something, right? The body's immune system is attacking something. That's what's creating the inflammation?
Right, we actually our immune system engulfs these crystals and breaks them down. But when we engulf them, we activate this thing in our body called the inflammasome. You can imagine, it's very inflammatory. If we named it the inflammasome.
Yeah, exactly.
And the inflammasome will immediately start a very inflammatory process. So call other white, immune cells to come over, cause the pain, cause the inflammation, cause the redness that we associate with gouty arthritis.
Okay. Can you see it from the outside? I mean, some arthritic conditions you see as you talk about those nodules. I've never seen gout. What does it look like? Is it something people only feel, or do you actually see the swelling in the?
You do. Yeah. You see it very much so in gout.
Okay.
So what you usually will see is a very swollen, very painful. Right. So I always tell people that this is the type of arthritis that will make a grown man cry.
Really?
It hurts that much, and it comes on suddenly. And you'll get pain, redness, swelling. Sometimes they can't walk because of how painful it is.
Okay. Does it occur in other joints other than the knees and the feet? Can it happen in your hands or elbows or shoulders? Any other joints?
It does. It often does happen. It's most common in the knees and toe, but can happen in the elbow. See it often in the elbow, in the wrist, in the hand.
And you talk about it coming on suddenly, so I could never have any arthritis or any other symptoms, and just one day develop this, this pain in the joint right out of the blue like that?
Sure, you can be absolutely fine.
Yeah.
You can go out and have a bacon cheeseburger and a dark beer.
Right, dark beer, really?
Yeah, it could be the middle of the summer.
It's too bad I love bacon cheeseburgers and dark beer.
Get a little dehydrated because maybe it's summertime and you're out at a barbecue, you've been at the beach all day.
Okay.
And that combination of factors will allow your uric acid to go up.
Why dehydration? Just because it's not flushing out the body? Or?
Right, so we naturally will excrete uric acid. Our kidneys will naturally excrete uric acid.
Okay.
So anything that interferes with the kidney's ability to excrete uric acid will increase the uric acid in the blood.
People at risk of people with kidney failure, are they more at risk of gout?
Yes, they are.
Okay.
So anyone who has decreased kidney function is at risk of gout. Anyone who takes medications that cause dehydration or decrease your kidney function can get gout. So certain diuretics like Lasix, furosemide, or spironolactone are very much associated with gout.
What about people that exercise a lot and maybe get dehydrated? Is that a potential? Or?
People who exercise a lot, well, I think if you're already predisposed to getting gout, so you have a genetic factor, or as we get older, we're more likely to get gout. Men are more likely than women to get gout. Women are more likely as they age. And then if you take in those other factors, sure. In someone who has a predisposition, if they were to go out and exercise in the hot sun and they didn't drink enough water, they could precipitate a gout attack.
How prevalent is it in the population? How often do you see it in your practice?
It's extremely common. It affects 1 to 2% of the population.
Really?
It is increasing worldwide. So we're seeing it in more countries than we've seen it before. And here in the United States and abroad, it's actually increasing. In the last several decades, we're seeing more and more gout.
Why do you think it's increasing? Is there any theories about that?
There are. Some of those theories include our diets. So diets that are very high in high fructose corn syrup, which is something that it's in a lot of our foods these days. That's one predisposing factor. Obesity, so people that are overweight, people who have the metabolic syndrome, which we see more these days, which is a combination of obesity, diabetes, high cholesterol, and hypertension.
I guess we're all eating like kings these days also. There's probably a little bit of that now compared to certainly in other countries, certainly as the standards of living are improving, they're eating better, probably the foods that may put them more at no genetic predisposition, can people still get gout?
Sure, anyone can get gout.
Okay.
There, of course, there are certain factors which make it more likely for someone to get gout. So someone who suffers from cardiovascular disease, so somebody who has high blood pressure, who maybe has heart failure, who has coronary artery disease, they're at very high risk of getting gout. People with kidney disease are at high risk of getting gout. People with diabetes.
And you said men are more likely to get it? Is there any
Men are more
theories
likely.
on that, or?
Well, estrogen is protective.
It is, okay. So anti-inflammatory, or it's or protective against uric acid?
Estrogen is protective against a lot of illnesses that we know of. I don't think we know exactly why estrogen is protective for a wide range of illnesses, but men are definitely at higher risk of getting gout.
Okay. So someone shows up, they've got extreme pain in their big toe or their ankle, and how do you go about diagnosing gout then?
So if someone were to come to my office and I was suspecting a gout attack, the first thing I would do is, of course, take a good history, find out what they've been doing, what medications they're taking, what are their other medical problems, and then I would examine them, and if they have, usually it's going to be one joint, sometimes it's a few joints that will be very hot, red, swollen, painful, and the way to diagnose gout with 100% certainty is to take the synovial fluid, which is the joint fluid, from the joint and send it for analysis.
Okay.
So when we analyze the joint fluid, we expect to see these crystals, these uric acid crystals. We actually see them in the joint fluid, and we actually see the immune system eating the crystals.
Really?
And that is pathognomonic for gout.
Okay. Will the immune system eventually work its way through all the crystals? I mean, what would happen? I guess one of the, we talk about stages of diseases, and in preparing a little, I saw that there's 4 stages of gout. What's actually going on then with the progression of gout?
So there's going to be a period where people have high uric acids, which we call hyperuricemia.
Okay.
So they have a period where you're walking around, you're not you're taking your medication, you're eating, living your usual life, but your uric acid is getting higher and higher and higher. And then perhaps one morning that person would wake up with an actual gout attack. And then there'll be a period after that gout attack where they will have been treated, or where it would spontaneously resolve and they'll be gout-free, but yet at risk for another attack.
Okay.
And then that over time can progress to what we call tophaceous gout or chronic gout, where that patient either gets frequent gout attacks, or they actually will develop tophi, which are collections of uric acid under the skin or in the joints.
In little pockets or something, or what is that?
They are. It's actually looks like it might feel like a bead in the elbow.
Okay.
Or in the Achilles tendon. They can collect really anywhere.
Okay. And the term that's used is an acute flare for that final phase where it's really flaring up, or what is the acute flare?
So the acute flare is actually when the person is experiencing the gout attack.
Okay.
When they're actually having the arthritis. When they're actually coming to the office, when they're trying to figure out what's wrong, they can't stand it anymore.
I've heard it described like a bee sting when it's really, is it that severe?
It's pretty severe.
Yeah. And how long does that last? I mean, if it were not treated, how long would the acute flare last? Does it resolve itself over time? Or?
So most of the times it will resolve over days to weeks,
Right.
but of course there are other factors that play, and those factors include the medications the people are on, their diet, their lifestyle, things like that. So there are times where the gout attack can be prolonged. It can last months.
Really?
But typically it will last a few days.
Okay. And if it's not treated, it sounded like you can develop chronic gout. What exactly is that, and how long will that last potentially? And what's the treatment for it? I guess that's the big question. What do you do about chronic gout?
So if people have multiple attacks, So if they have more than 2 to 3 attacks per year, or they have evidence of these collections of tophi, either in their elbows or sometimes I can see them on x-ray. I can actually see these tophi eroding into the bone, and they have a very classic x-ray.
Okay.
If I find those, then that's what we would consider either tophaceous gout or chronic gout. And those people we would place on long-term therapy, which would include what we call urate lowering therapy, where we would lower the uric acid in their blood, both to prevent more gout attacks from occurring, but also to rid their system of the uric acid that has built up.
The excess uric acid is. It sounds not so good, actually, where it starts to erode the bone. What are the long-term ramifications of untreated gout?
I think there are many long-term ramifications of untreated gout, and I think we're learning more and more about gout and uric acid as this metabolically active molecule. And we now understand how important it is for people to treat their gout and for their doctors to check their uric acid.
Okay.
Much more so than we understood in the past. So my recommendation is that everyone with gout should really at some point see a rheumatologist.
Okay. And get the full spectrum of tests and things done.
That's good, yeah.
You mentioned testing the uric acid. Is that something that somebody's at risk should be doing as part of a routine physical, or typically you don't test until they actually have the flare-up of gout?
Well, typically most people aren't testing until there's a flare-up of gout.
Okay.
The interesting thing though is that during a flare, the uric acid is usually low. So it can be misleading to doctors or to the patients, because when they're actually experiencing this severe arthritis and someone checks their blood, their uric acid might be extremely low.
All right.
So, well, how do you know I have gout? But if we test it before or if we test it after, when the gout attack has resolved, that uric acid will then go back to what it normally is. And the reason that uric acid goes low during the attacks is because it actually precipitates out of the blood into the tissue. So there's less of it when we're measuring it.
Interesting. And is it something, when is somebody age-wise likely to start to see signs of gout? Is it something that can happen at any age, or is it more likely to happen as people get older?
It's definitely more likely to happen as people get older.
Right.
In men, you can probably see it, any time after their 30s. There are some genetic conditions where people can even get it younger than that.
You ever see it in children?
Not usually in children, but I've seen it in 20-year-olds.
Okay.
Although that's very young, and those
Right.
people really do have a genetic predisposition. And then some people in their 30s, depending on their lifestyle and their genetic factors, but more and more as they get older, so 60s, 70s, 80s, and in women as well. So in women we see it typically, a decade or so after menopause, and it increases after that.
Okay. Somebody has that first flare-up of gout or first attack of gout. What's the treatment? I mean, they get it and go away. Can they just sort of forget about it, or what do you recommend if somebody has that first flare-up of gout?
So the good thing about gout, it's something you can do. It's something you can do something about at home on your own. So as soon as someone would suspect that they were having a gout attack, they could immediately start to ice that joint.
Okay.
If they're able to.
I never can remember ice or heat. There's always
ice. Definitely ice gout.
Ice.
Definitely
Okay.
ice gout. If you put heat on gout, you could make it worse.
Oh, really? Okay.
So definitely would ice it. And ice it as much as you can, 20 minutes on, 20 minutes off.
Okay.
Then if you're able to, if there's no reason you're not able to, you take some anti-inflammatories. So you can take some Advil or Motrin or ibuprofen, whatever it is you have at home, Aleve. And you would take that in regular increments as directed on the bottle or by your doctor. Then you should let your doctor know that you think you're having a gout attack.
Okay.
And they would be able to advise you further. We have medications that are very specific for gout attacks that, of course, require prescription.
Okay. Is the if they've had one, are they likely, I guess they would be probably
Right.
more prone to have other ones also. And then is there any other than anti-inflammatories, there's a medication called colchicine?
Colchicine.
Yeah. What is that exactly, and what's that doing?
So colchicine is directly interrupts the inflammatory process of that cell that we talked about, the inflammasome.
Okay.
So it's very specific for the treatment of gout.
Okay. Is that over the counter or no?
No, it's not over the
prescription.
counter.
Oh,
It's a
okay.
prescription, but colchicine has also been around since ancient times.
Really?
So it's a very old medication that we still use because of how effective it is.
Right. And it's derived from the autumn
From the autumn
crocus tree?
crocus.
Yeah. What? I don't even know what that tree is, but it's amazing that they.
It's a flower.
Okay. And it's the medication's actually derived from that as an ancient treatment. So.
Yeah.
Interesting. And are there any other medicines that may put a person at risk actually for gout?
So there are the ones that we spoke about earlier would include, Lasix, furosemide, any type of diuretic.
Okay.
So spironolactone, hydrochlorothiazide is a very common one.
Does that have a common name? Hydrochlorothiazide?
HCTZ.
Oh, okay. Okay, great. Anything over the counter that you would recommend that people maybe not take for gout? Any sort of herbal medicines or anything like that that trigger any reaction? Or the other, is there anything people can take just as a preventive?
Well, there are some people who take cherry juice, or they
Okay.
eat a lot of cherries.
Cherry juice? Really?
Cherry juice or cherry
does that
extract.
Work? Is there any proof that
There
works?
is proof that it does work because it
Yeah.
decreases the inflammation and may help to decrease uric acid.
Okay. What's in cherry juice? That's
There's a molecule,
okay.
I believe it's called anthocyanins,
Okay.
and they help to decrease inflammation.
Wow, that's. I guess I'm going to go start shopping for cherry juice actually. So it's. How does someone know too if somebody's physically active and they may be doing a lot of running or some kind of physical exercise where you get a little joint pain anyway? How would you know when somebody should start thinking, oh, that's not just the usual joint pain. This is something more. This may be gout.
So I think gout's really difficult to miss because it usually is more than just a twinge.
Okay.
It will be debilitating. It will interrupt your ability to walk or use your hand.
Okay.
It will be so painful that even the sheet in your bed would hurt.
Really? Just pressing against the
Yeah.
surface of it?
And gout typically occurs first thing in the morning.
It does.
So it's usually something that will wake someone up out of sleep and usually worsen throughout the day.
Really? Okay.
One attack of gout can be treated just that one attack.
Right.
And there are times where people have one attack and they may not have another one for 10 years.
Really? Okay.
And there are other people who become more chronic and will have an attack every couple of months.
Couple months. Wow. Boy, I would think it would be something. Certainly, if you're getting it every couple months, you'd want to get treated as quickly as possible.
You would, and there are of course some people who have hyperuricemia, which is elevated uric acid, don't really experience so many of the attacks, but will still accumulate the uric acid in the tissues.
Things people can do just as a preventive then, from diet or exercise, any lifestyle factors that really people can change to really reduce the incidence or likelihood that they'll have another gout attack.
Sure. Gout is one of the arthritides, or the arthritide which is most responsive to diet.
Oh, really?
So it is very important to try to follow a low purine diet, especially for someone who has gout or who may be at risk. So that's going to be things like avoiding high fructose corn syrup.
Okay.
So you don't want to be drinking Coca-Cola or Snapple, things like that. You want to stay very well hydrated, so make sure you're drinking plenty of fluid, especially during the summer months or when you're exercising. Also, we want to avoid foods that are high in purines, like red meat, pork,
Okay. Poultry?
shellfish.
Poultry?
No, chicken's okay.
Chicken's all right,
Chicken,
okay.
turkey's okay. But shellfish, like oysters and shrimp and lobster.
Oh boy, that's hard to avoid out here. I guess though, with the pain of gout, that's certainly the incentive to avoid it. So, yeah. Other things, what about exercise? Is that something, does exercise help or hurt?
Well, I think exercise is, for the most part, almost always good for you.
Right.
So I wouldn't exercise at the time of an acute attack,
Okay,
but there's no reason you can't exercise the rest of the time.
great. And we're just about out of time, but just one question. Any research being done to really, it's an ancient disease, anything being done to really make this disease something in the past? Are there any, probably no immunizations or anything like that, or maybe there are, I don't know. Is there any new research around gout?
So I think the new research now in gout is focusing on uric acid as this metabolically active molecule, which can cause other medical problems or can actually worsen other medical problems. So that's been the focus right now. Like, what is the effect of uric acid on our heart? What is the effect of uric acid on our kidneys? And what is the effect of uric acid on diabetes and other chronic illness?
Okay, great. So I guess we should all stay tuned, right? So,
We should.
thank you, Dr. Karis, so much. This is fascinating, and I certainly know a lot more about a term I've used many times, but didn't really know what it was that I was talking about. And I'd like to thank all of you for watching us today, and hopefully you all learned a little bit about gout. Also, if you have any other questions or would like some additional information, please feel free to contact Dr. Elaine Karis. She's in our Meeting House Lane practice in Hampton Bays, where she sees patients. Her number is 631-594-3910. I know that Dr. Karis has been very, very happy to see people in our communities. I'd like to thank CTV for the great work that they're doing in producing this show and airing it in Southampton, and our friends at LTV for airing it in our East Hampton communities. If you have a question or concern or just need help navigating our health system, as always, please give me a call in my office at 631-726-8555. Thank you, everyone, and good health.